More than 1,200 health professionals across the nation, including 250 from California, have signed an open letter urging leaders to hit the reset button on the response to COVID-19. Among them is Dr. Steffanie Strathedee, an infectious disease epidemiologist and an associate dean with the UCSD Department of Global Health Sciences. Dr. Strathedee, welcome.
Thanks very much for having me, Jim.
So based on what you're seeing, where are we in terms of this virus right now?
Well, we were doing all the right things in California for a while. We had, people sheltering in place and really paying attention and doing the right things. But we opened things up too early. And we're on the right track again. We're starting to see in San Diego County, we're down to like roughly 260 new cases a day. And we were at 600 just a couple weeks ago. But that's not enough to stop the epidemic. So we've got to not just flatten the curve, we've got to crush it.
Are we opening up too early, though, in terms of what's opening up too early? There's a huge debate, as you know, going on in the country saying, well, why can Walmart, why can Costco, why can these stores open up? Yet you want to say, close down the beach, close down the bars or the salons. And folks are saying this seems awfully random from your medical standpoint. Is there any rhyme or reason to who we're saying can stay open, who has to close down?
Well, I think the biggest problem is that we don't have a national coordinated plan to mitigate coronavirus. We have left it up to the states, and some of the states have left it up to the counties, and everybody's doing different things. And as long as that happens, this virus is going to smolder and it's going to continue, and we're going to see more surges. So we should have a national mandate for face masks and social distancing at the very least.
If we have that mandate and people follow it, could we reopen then?
Well, the study that you just referred to, done by the folks at the University of Washington, suggests that we're on track to having 300,000 coronavirus deaths by December 1, but that if we mandated national face masks, that we could reduce that and reduce it by 70%. So, that would be really impressive. But at this point, we're not there yet. We're a long way off. We still have some states' governors saying that they will, prevent anybody from insisting on masks. And that's the opposite from what we're saying as scientists.
And where are we right now in terms of a vaccine? Do you have any other inside information on how this is progressing and how soon we could see one?
Well, I'm following the science very closely, just like many of you. And, the early results from some of the vaccine candidates are looking very good. However, it's going to be the earliest as possible is probably, early 2021. And even if a vaccine comes on the market, it's unlikely to be 100% efficacious right off the bat. So this means that people need to be wearing face masks even when there's a vaccine. And so we got to get used to it. Think of it like a seatbelt, but it's one that's going to protect you from dying.
We've talked about how it's been called Operation Warp Speed, and that's leading to some people feeling like, look, this vaccine cut corners to get produced so quickly. From your experience, is there any possible truth to that, or are we doing all the things we should be doing in terms of the creation of the vaccine?
Well, there are legitimate concerns that we could be rushing too fast. Obviously this is an election year, and there's some folks that want to be able to claim a vaccine success before November 3rd. But we are being ruled by the virus right now. So we've got to pay attention to the data. We need to do the randomized control trials with vaccine candidates to show whether or not it works and whether it's safe. And then we can consider rolling it out. But we've got some supply chain issues to deal with before that will happen.
Dr. Steffanie Strathedee, a pleasure to talk to you today.
It's my pleasure too, Jim. Thank you.
Thank you so much.
Stay safe.
It's most certainly you too.